I've collected some of the top questions that you have all asked me on TikTok, and I am here to break it down for you. For those of you who don't know me, I'm Dr. Mamina, a triple board certified dermatologist, and I'm here to help you navigate skincare with a balance between science and a holistic approach. Whether it's viral trends or everyday skincare, I am here to help you make an informed decision because everyone's skin is different. Before we get started, if I don't answer your question, feel free to drop it in the comments. I'll try to answer it there or maybe feature it in my next video. All right, our first question from Gabby. Can you discuss why the gua sha is controversial? All right, well, overall, I have to say that I am a personal fan of gua sha. I like to gua sha. I think that it's a tool that essentially like massages your face, and I think that it promotes circulation, and I think in turn, it brings more nutrients to your skin, you rejuvenates the skin, you have more of a glow. So overall, I'm a fan, but why is it controversial? A couple reasons. One, I think it's the dermatologists who are like, don't gua sha, or are questioning it because there are so many trends that talk about how gua sha can replace things like Botox, and I don't think that it can replace Botox. Botox, first of all, is completely different and does different things, but people talk about how it's like the holy grail and like what you need for good skin. What I have to say to that is I think it can definitely complement a good skincare regimen, but I don't think that it is like the thing that replaces everything. I think having a good skincare routine and doing other things, whether it's in-office treatments or living an overall healthy lifestyle, these are all important components to having healthy skin. And using gua sha is just part of it. Okay, another reason why it could be kind of controversial is if you're prone to redness or rosacea, and really, I would say any skin type, I would just not use it so firmly on the skin. I would use it more gently and really just use it more to just massage the skin ever so nicely. But yeah, overall, I'm a fan. All right, we have our next question from Create with Caramel HT. Wait, can you explain more about the flakiness between the brows and around the nose? I get that a lot and just thought it was because I have dry skin / eczema. Okay, this is such a common thing. The dry skin that we see between the brows and on the sides of the nose is actually not really dry skin. A lot of people think it is, and what they'll do is just continue to moisturize. They'll even use like Vaseline on it. And sometimes that can temporarily like mask the flakiness or hide it, but it's really not addressing the problem. So that flakiness that you see between the brows or on the sides of the nose is a condition that we call seborrheic dermatitis, which essentially is dandruff. And this is dandruff on the skin. And that flakiness is a byproduct of yeast. So we all have yeast that lives on our skin, okay? That's completely normal. We have a very extensive microbiome, this ecosystem that lives on our skin of different microorganisms, and yeast is one of them. But when your skin produces a certain type of oil, it can feed this yeast, and the yeast is happy, it's having a party, it's feasting on the oil. The byproduct is flaking and sometimes redness and inflammation. So when we see that flakiness, we recommend using ingredients and products that can fight the yeast and treat the dandruff essentially. So using an anti-dandruff shampoo is helpful. Things that include ingredients like zinc, Head & Shoulders has that. There's Celsa Blue, which has selenium sulfide. Also, there's a shampoo called Nizoral shampoo, which has an anti-yeast ingredient called ketoconazole. I would just be a little bit cautious because these shampoos are essentially made for the scalp and they could be a little bit harsh for the face. I wouldn't use them every day, or maybe just focus on those areas. Another ingredient that I like for seborrheic dermatitis is sulfur, and there's different sulfur soaps that you can get like on Amazon. Of course, if this does not go away with over-the-counter products, we definitely have lots of good medications that we can prescribe as dermatologists. All right, next question from Nicelle. Do you know of a skincare line or products that would be good for sensitive, combination, maturing skin that has dark spots and uneven skin tone? Okay, so in terms of product lines that I like for sensitive skin, I am a fan of Vanicream, Aven, La Roche-Posay. Cetaphil has some good ones. Eucerin has some good ones. But you were also asking about maturing skin with dark spots and uneven skin tone. So combo maturing skin does pretty well with like sensitive skincare products, but the dark spots and uneven skin tone. So among those brands that I mentioned, La Roche-Posay and Eucerin both have skin lightening products that can be helpful, both cleansers as well as serums and sunscreens. So in the La Roche-Posay line, they have their Melasil. It's their Mela B3 line. They have the Mela B3 serum. They have the sunscreen for it. and it has the proprietary La Roche-Posay spring water in it. So I love it. It's like soothing. And this ingredient has so much research behind it, like multiple years of research, and it's not harsh on the skin either. So I do like that for people who may have sensitive skin and they're looking for something to still help like lighten dark spots on their face. Eucerin, so cool. So they of course are great at making products for people with sensitive skin. They just came out with their Radiant Tone collection, which contains their proprietary ingredient thiamidol, and that has been shown to also help lighten dark spots. And they have like a cleanser in that collection. They have like a serum, a moisturizer, a sunscreen. So I would say either of those lines would be helpful. Always, if you have any questions, I would of course talk to a dermatologist. If you have dark spots and dark marks that aren't going away with over-the-counter treatments, you might want to see a derm. Sometimes I would just say it's just good to see a derm right off the bat because they can help you with a diagnosis. Maybe like topical treatments may not be the answer for them and you may need like something like a procedure. Our next question is from Holly. I just recently tried Tretinoin and it really irritated my skin. I decided to stop, but I can't get back into the dermatologist for another 2 months. What would you recommend I use in the meantime? All right, this is unfortunately something we see semi-often. People just getting irritated with Tretinoin, especially when you first start using it. So first of all, don't use the Tretinoin, just stop. And you only want to use gentle products because your skin barrier is probably irritated and compromised at this point. You want to just use skin nourishing ingredients like a gentle cleanser that doesn't have any like exfoliating ingredients in it, gentle hydrating cleanser, a moisturizer, potentially petroleum jelly if you don't have oily or acne prone skin for like a few days, okay? Like that's only what you want to use. I would avoid even vitamin C or other potential actives that are in other like serums, basic moisturizer, and or like I said, something like petroleum jelly or Vaseline. Now, when it comes to using Tretinoin, it's possible that you can use it. You might want to like start with something a little bit more gentle, like an over-the-counter retinol. But if you really want to give the Tretinoin another chance, of course, wait till your skin barrier heals. So I would wait at least a week. And when using Tretinoin, I would put a layer of moisturizer on first. And the Tretinoin, make sure it's only a pea-sized amount, okay? It does not seem like a lot. It feels like it may not be doing anything. It is doing something. And if you use more than that, you're gonna just get more irritation without any added benefit. Pea-sized amount, dot it evenly across your face, 5 dots. Spread it in, and then I tell patients apply a second layer of moisturizer on top of that. We call that the retinoid sandwich. And I would only do that like once or twice a week, especially if you've had that reaction to Tretinoin. You may be able to go more often than that, like 2 or 3 times a week, but start low and slow is what I tell people. If that's causing irritation, you could just put Tretinoin on for a few hours. Like you could put it on like when you come home and for the evening and just put it on your face for like 3 or 4 hours and then wash it off. That's called short contact therapy. But if you continue to get irritation, definitely bring that up with your dermatologist. And like for something like that, like if I have a patient who's dealing with irritation after starting a medication, if they can't get in to see me, then I'll call them on the phone. Like don't hesitate to call your dermatologist's office if you're having a reaction to any medication. Like it's the doctor's responsibility to like help you deal with any kind of side effects that you may be dealing with. Little side tip right there. All right, we have our last question from Okendo family. Can you talk about what or how to fix, if even possible, turkey neck? Thanks. Very common question. Turkey neck. Skin laxity on the neck is a very common issue, and we see it more and more as we get older. I do have to say, quick thing, all your skincare, and this is something I regret not doing for a long time, is use your skincare on your face, on your neck too. Your neck skin is a little bit more delicate than the rest of your face, so I would be cautious with things like retinoids or even things like vitamin C. But essentially you want to bring your face care down to your neck. I think dermatologists are kind of mixed on neck creams. I am personally a fan of neck creams. I do think that sometimes, like I said, the neck skin can't tolerate certain ingredients like certain retinoids. And so I recommend looking for neck creams that have other collagen building ingredients like peptides, antioxidants, and like just growth factors and other like skin nourishing ingredients. Okay, so I don't know how bad this turkey neck is. So some of what I'm saying may not even be relevant and you may just need surgery. So one procedure is ultrasound therapy. It's most commonly known as ult therapy, but it uses ultrasound and like heat technology to get into the deeper layers of the skin to tighten and firm that skin. So that's one. Not everyone's a candidate. So obviously you want to like see somebody and like have them evaluate and see what you're a good candidate for. Another procedure which we do have in our office is radiofrequency. So radiofrequency can be used in devices like Thermage and Exilus to get into your skin, also kind of heating up the skin to tighten the tissue. Okay, then there's also radiofrequency with microneedling or microneedling by itself. And this is when, during the microneedling process, radiofrequency waves are being emitted. I do have to say, I think I prefer microneedling and microneedling with radiofrequency to treat like crepiness, like some more textural issues on the neck. And then there's also injectables. So I know you said turkey neck, but sometimes people can get really prominent bands in their neck, and like injecting a little Botox, game changer. It can completely change the shape of the neck. That's kind of an underrated procedure, I think. But once again, you need to get evaluated because not everyone's a candidate. And then like I said, if it's pretty extensive sagging, then surgery is gonna be your best bet. Okay, so I love this. I love answering random questions and making videos out of them because I feel like so many people, if one person's asking them, I'm sure a lot of other people want to know the answer to it. If you have any questions, leave them in the comments. If you enjoyed this video, remember to like and hit subscribe and stay tuned for weekly skincare and overall skin health and wellness tips. See you next time.